Hello, I'm Brian Wolfe, City of Woodstock Council Member for Ward 5. I'm here today with your Woodstock Fire and Rescue Chief, David Soumas, to discuss what the city is doing during this COVID-19 pandemic. So what the government's doing and what his department in particular is doing to combat this disease. Good morning, Dave.
Good morning, Councilman.
So what's being done to protect your firefighters and EMTs and paramedics as they respond to calls in the midst of this crisis?
Well, the first thing that we're doing is we're wearing our personal protective equipment, which consists of gloves, N95 masks, and eye protection. Also, our response is limited to, we're trying to limit the personnel that come in contact with patients. So that is the main thing we're doing right now.
But it sounds like a lot of departments are doing the same thing. So it seems to be pretty much in line. So was some of that direction through Department of Public Health or CDC guidelines, or was that just something that you just kind of came up with on your own?
We are following CDC guidelines and also following the medical director. We're under a medical director in the city of Woodstock, and we are following her guidelines.
Okay. Do you have all the PPE that you need so that your crews are protected?
Right now, we have plenty of gloves, and we're okay on N95 masks. We are struggling with gowns. I had mentioned before that we use eye protection, mask, and gloves. On some cases, we need gowns, and we are struggling on the supply of gowns.
Okay, well, we need to see about being able to do something to be able to procure some of those items for you. If people are experiencing symptoms, so kind of moving to the public now, and if they're experiencing any symptoms, is it necessary for them to seek testing?
It depends. So if they meet some criteria, underlying medical issues, if they're over 60, if they have a fever, then we would recommend that they call their doctor, call ahead on their doctor, or they can call the Department of Public Health, the North Georgia Department of Public Health. Their phone number is 888-881-1474. And the Department of Public Health would ask them certain questions to see if they meet the criteria for future testing.
If people are having symptoms, what should they do? And what symptoms should they be looking for?
They should be looking for symptoms such as fever and upper respiratory difficulties. So I would say that if they are having difficulty breathing, chest pains, high fever, I would recommend them call 911. If they don't meet the criteria and have mild symptoms, they should just notify their doctor, give them their symptoms, and then they can decide if they need to go to the doctor or not.
I got you. So just a regular run-of-the-mill fever, say it was 101 temperature, but they don't have anything else. Should they just kind of stay isolated in their house for the time being and contact their healthcare provider, or would that be a trigger for them to call 911?
No, you are correct. If they had mild symptoms, that wouldn't be a trigger for 911. I would recommend they contact their health provider by phone, and but they should quarantine and isolate in their homes.
Understood. So we've seen on Facebook that some companies and individuals are providing meals for first responders. What else can the public do to help in this time?
The public has been great reaching out. They've been feeding our first responders, coming by the fire station, dropping food off at the fire station, and they've really been a great help to us. Don't forget about gowns. We could use gowns. We had some gowns delivered to us from a local dentist's office, which really was a help, but we still need more. But I would ask if they would consider giving to the Woodstock Public Safety Foundation. They can get online and look at that, wpsfoundation.org. And once they get on that site, they could donate directly to that site, which goes to the firefighters in need.
Understood. So I do have a question about how are our guys doing? Are they, they come to work prepared every day, or is there some kind of heightened, level of frustration or anything like that?
I think all of the above. Ever vigilant. They signed up to go out there and do this. I'm so proud to work with our guys. They're running these calls daily. We had some guys in quarantine for a short time, for the 14 days. They're all back at work, thank goodness. We're all taking the proper precautions, but I think it's a new day and time that we're looking at. We have, I kept mentioning gowns. We have put in through GEMA a request for some supplies, which we haven't heard back from yet. So that could be a little frustrating, but we're marching on. It's a new time. We're changing our response level to limit contact, so we won't have many firefighters in contact with a sick person, but we still have to respond to those calls daily.
Understood. Well, I do want to let you know that myself, as well as the rest of the council, really appreciate everything that y'all are doing on the front lines, just fire and police, as well as some of our other essential workers in the city that are out there doing things to maintain our infrastructure and everything. But you guys in the police are truly on that front lines, having intimate contact with the individuals when y'all go out on the call. So thank you very much. Do you have any other questions?
No, we appreciate the information that the mayor and council is putting out. Has really been helpful. We thank you for your support also.
Well, it's our pleasure. We're proud of the job y'all do for all of us and the citizens.
Thank you, sir.
Thank you, and have a good day.
You too.